So, hello guys, welcome back to my YouTube channel. My name is Divya and I am CPC certified coder. And today's session will continue with the musculoskeletal system. And our today topic is manipulation and the amputation. Okay, so let's begin, guys. So, topic is 89. Okay, manipulation. So, what is manipulation? What do you mean by manipulation and why it's need to be manipulation? So basically a manipulation is a non-surgical procedure in which a physician will forcefully moves a joint or body parts to restore its normal range of the motion because of the joint stiffness and because of the some infection because of the deformity and to adhesion and scar tissue, the manipulation will be done and there will be a non-surgical. It means there will be no incision will be there. For example, here is an you can see in picture that patient is coming for the joint stiffness and physician what do forcefully moves the joint to restore the range of motion. Okay, so the common conditions are the frozen shoulders, which is also known as the adhesive capsulitis, joint stiffness, and post-fracture stiffness, and the dipteran contracture. So, what is dipteran contracture? It is an a hand deformity in which the fingers, most commonly the ring finger and the little finger, bends towards the palm and cannot fully straighten. So, so these are the common conditions for the manipulation. And what will physician will do? If needed, the physician will give anesthesia. Otherwise, as it is, he will perform the applies the force and move the joint with the full range of motion and breaks the internal adhesion, checks the improvement immediately. Okay. So next. So what are the types of manipulation? So basically, there are three types of manipulation. That is an orthopedic manipulation, uh, fracture or dislocation manipulation, and the manipulation under the anesthesia. Orthopedic manipulation is what? Joint manipulation, like a shoulder, knee, hip, and the fracture and dislocation manipulation, that is in close reduction with manipulation. So what is fracture? Fracture is in basically crack in the bone or the tear in the bone. Okay, so physician will do the treatment close reduction with the manipulation without incision. Okay, always remember that the manipulation is a non-surgical procedure. Okay, and the third one, manipulation under anesthesia. It means if the patient having in severe stiffness and then physician will give the anesthesia and then the manipulation has been done. So ICD, that depends upon the conditions. So ICD, like you can see here, the joint stiffness M25.60 series, contracture M24 series, and the frozen shoulder M75 series, and the hand contracture M72. So we'll navigate all these while doing an operative report. So based on the location and site, CPT is also there. That is an soldier manipulation, upper limb and lower limb. So 23700 soldier manipulation, elbow manipulation. So these are the manipulation of the upper limb. Okay, and each additional fingers for the finger manipulation is an 26341. That is an additional. Okay, additional CPT code. For the lower limb, that is an hip, knee, and ankle manipulation 272 series, and these are the screenshots of the CPT book for the manipulation. So important guidelines is that when to code manipulation and when to not code manipulation. So basically, if the manipulation is an independent procedure and properly documented and there will be no bundle, then we can code the manipulation separately. It means there will be on single procedures will be going on the for the manipulation, and there will be no other procedure. That time we can code the manipulation code. And when to do not code separately? Uh, when there is in some another procedure, for example, the fasciectomy is going on, and then the fasciectomy includes the manipulation procedures. Okay, so we'll see which type of procedures include the manipulation. So the fracture treatment procedure, dislocation treatment procedures, and the joint reduction procedures, and the orthopedic closed procedure, and some also other procedures includes the manipulation. So here we'll see one by one. In the fracture treatment procedure, there is an manipulation is included when the documentation say like closed reduction with manipulation, closed treatment with manipulation. As it is shown there, manipulation is included in that closed treatment. Okay. Example, the closed treatment of fracture, that is closed treatment of fracture with the manipulation which is included. Reduction of displaced fracture is also includes the manipulation. Okay, manipulation is basically just simply a forceful activity. Okay, so now dislocation treatment procedure also includes the manipulation. So manipulation is in part of the reducing a dislocation. Example, shoulder dislocation reduction, finger dislocation reduction. In the joint reduction, any joint realignment reduction includes the manipulation. So if there will be a realignment CPT code and reduction CPT code, then we will not give the manipulation code with that. Okay. Example, hip reduction, elbow reduction. These procedures, these codes, these procedures code includes the manipulation. Okay. And orthopedic closed procedure, if procedure is closed and no incisions involved, and there will be a repositioning will be there, then it means that manipulation is already included in that procedure. Example, closed treatment of joint injury. It means there will be no incision, just only repositioning or realignment has been done. So that procedure includes the manipulation. So we'll not code manipulation code. Now, some tendon ligament injury and some casting and split strapping with the fracture includes the manipulation. So we'll not code with these manipulation. Okay. Now we'll see one example of the operative report. Okay. So here is a manipulation operative report. What it say? Preoperative diagnosis is right knee stiffness and decreased range of motion. Okay. And post-operative also same as preoperative. And what are the procedures performed? Manipulation of right knee under the anesthesia, which is an one main key point. That is, manipulation is done for the right knee under anesthesia. Now you'll see the indication. That is the patient with the that much year old with persistent stiffness of the right knee following the prior surgery, and when the conservative treatment failed, so the manipulation under anesthesia was planned to improve the range of motion. So what are the procedure description? We'll see that the indication and procedure just match to the procedure details or not. So the patient was brought to the operating room and placed in the supine position. After that, the general anesthesia was achieved to the right knee. So the general anesthesia given and the right knee was there. And the gentle but firm manual manipulation of the knee joint was performed. So here is written that manipulation of knee joint. Okay. And the knee was gradually flexed and extended to the break intra-articular adhesion and improved mobility. So here is an adhesion and noticeable increase in the range of motion was achieved. No complication occurred during the procedure. So we'll see the navigation of that procedure. Okay. So first, what is the ICD diagnosis code? Right knee stiffness. So we'll navigate like stiffness. Knee. Which side? Right side. Laterality. Any joint disorder? No. So will not. So this is the ICD M25661. For the procedure, what key points were that we have seen that manipulation is done under anesthesia and range of motion has been achieved, and there is a location that is knee joint, so manipulation is done, and adhesion and improve mobility. So we'll navigate by this manipulation manipulation of the joint. Which joint? Knee joint. With requiring anesthesia? Yes. Which anesthesia? General anesthesia. So what were the codes? 27570 with a modifier with your right side. So we'll give the RT modifier with that. Okay, it's simple. Now we'll see the next OP that so next OP that is an displaced distal radius fracture, preoperative and postoperative same, and the procedure performed close reduction of the right distal radius fracture and application of short arm cast. Okay, and the indication is what? The patient sustained a fall and present with pain, swelling, and deformity of the right wrist. X-ray confirmed a displaced distal radius fracture, and the close reduction was planned to restore alignment. And the procedure description: patient was placed in supine position, and after adequate anesthesia, a manual traction and manipulation of the distal radius was performed to realign the fracture of fragments. And once the acceptable alignment was achieved, the wrist was immobilized using a short arm cast, and post reduction X-ray confirmed good alignment. So we'll navigate. So what is the here? Here's a diagnosis is displaced distal fracture, and here is a close reduction done for which distal radius fracture, and here is an application of short arm cast. So we'll not code for the application of the short arm cast, and will not will not give the manipulation code specially because here is a close reduction of the fracture which includes the manipulation. So we'll navigate for the ICD, disc fracture, displaced fracture, radius was na, radius is there, and the distal end were there, unspecified. Which side? Right wrist. So we'll give right. Encounter were initial, closed, no persistent, external cause no. So here is an S52501A. Okay. And for the procedure, that is a closed reduction of the right radius distal fracture. That is a manual traction manipulation was done. Alignment was immobilized. So we'll give the reduction of the fracture. Other specified. It was radius only, na? Only radius, distal end were there. And which there is a closed treatment. Open not because there is a no any incision, so closed. Without internal fixation because internal percutaneous fixation, internal no. So without internal fixation, without debridement, and any fixator device, no. So this is an CPT code for the closed treatment of the distal radius fracture, and we'll give the ICD modifier that is an right. Okay, so this one. So next we'll see the amputation topic. Amputation topic we'll see. Amputation. Okay, so we have covered the manipulation topic. Now amputation. So what is amputation? So amputation is basically a removal of the limb or a part of the limb, that is a finger, toe, hand, foot, arm or leg from the body, and it can be a partial or maybe the complete. Okay, so why amputation is done? Why? Because of the severe trauma, because of the tissue death. If there is a blockage in the veins and arteries, and if there is an infection in an area of the limb or a part of limb, and if there is an diabetic complication, infection, So for that purpose, amputation is done. Here you can see in the pic. For example, if it is an foot region, okay, for their thumb, their toe, uh, that one, there is an infection here. So because the infection here, and it will chance or risk that it will spread to the healthy tissue. So physician will do the amputation and removes the toes. Okay. Similarly, in the lower knee, and you can see at the in the hand. So these are the amputation examples. So due to the trauma, due to the malignancy infection, due to the PVD, for that purpose, the amputation is done. That is a removal of the part or a part of limb. Okay. Now, so what will physician do in the amputation procedure? First of all, he will evaluate the area. He will examine the affected area. Okay. After examination of the affected area, he will decide the which level of amputation will be there. Like he will identify the foot region, below knee, above knee, toe, or the hand. He will see and decide the level of amputation. And after that, he will surgically remove the diseased or the damaged tissue. And he will control the bleeding and saves the bone and preserves as much healthy tissue as possible and close the stump. So what is a stump? A stump is, here you can see that after doing the amputation in the below the knee, what will physician do at the end? He will just smoothen that area for the recovery. Okay, so that one is stump. And after that, the rehabilitation planning and post-operative care have been provided. So next. So there are different diagnoses like type 2 diabetes and gangrene, E11 series, I96 for the gangrene, that is in tissue death, bone cancer, osteomyelitis, and the acquired absence of limb, that is in status, Z89 series. So we'll see that navigation in the after coming, we'll do the operative report. So, so these were the CPT codes, and CPT codes depends on the sites and the level of the amputation. So here is these are the foot amputation of the metatarsal, and this is also known as Chopard type of procedure. 28805 for the amputation of the foot transmetatarsal, and here is in 28810 amputation of the metatarsal with the toe single, and 28820 amputation of toe metatarsophalangeal joint, and here 28825, that is amputation of toe interphalangeal joint. Okay, so is a leg, hand, based on the site and the level of amputation. Here is an amputation of the leg through the tibia and fibula, immediate fitting, open circular, guillotine, and 27884, that is a secondary closure and scar revision and the reamputation. So these were the CPT code you can see. Okay. So here it is amputation of the thigh region through the femur, any level. And here is an amputation of the arm through the humerus with the primary closure and open circular guillotine. So here is an guillotine, that is an amputation for the open circular of the arms through humerus. Okay. Similarly, here is an amputation of leg through open circular guillotine. So you can learn that word, that is very much important. Sometime in OP, you can see that not the amputation like open circular, you can see that guillotine, or you can sometimes see the Chopard type of procedure. So you have to just remember that amputation of the foot metatarsal region is in Chopard type of procedure. Okay. So what were the criteria for the amputation? What were the keywords we'll see in the OP report? First of all, we have to see the level of amputation, whether it is an knee region, toe region, finger region. Okay. After that, we have to see the which type of amputation, whether it is an closed, open, primary versus secondary, traumatic versus surgical, and the laterality and modifier as per the documentation, and the indications like the gangrene, trauma, infection, that for the diagnosis purpose, and the approaches like the open procedure and the closure details, whether it is an primary closure or delayed closure, and the additional procedure, that is an debridement, which may be sometime many time included in the amputation topic. Okay, but if there will be a separate, then we can definitely code the debridement with the amputation. Okay, and some prosthesis fitting after that. So these are the document keywords, that is an level and site of amputation, laterality, viable and non-viable tissue, flap creation must be there, and bone cutting like osteotomy, hemostasis achieved, stump formation, trim, smoothen area, prosthesis, planned immediate. Sometimes amputation or and another word like that is an disarticulation. So there is a very basic difference in the amputation and the disarticulation. That is an amputation. What is amputation? Amputation is a removal through the limb, through the bone. Okay. And the disarticulation, removal of the limb through joint area. Okay. So you'll see one operative report for the amputation. So here is a pre-operative diagnosis, that is a diabetic foot with the gangrene, right lower limb, post-operative same. The procedure is right knee below amputation, and anesthesia is general. Indication is patient with long-standing diabetes presented with non-healing ulcer and gangrene of the right foot, and limb was non-salivable, planned for amputation. And what is operative note description must be? We have to see that. The patient was taken to the OT and placed in supine position. After aseptic preparation, a long posterior flap incision was made, and below the knee, soft tissue were dissected and tibia and fibula were transected, and non-viable tissue was removed and hemostasis achieved, and the stump was saved properly, and the primary closure was done in layers. So here you can see that the flap incision, and the reason is knee, below knee, soft tissue dissected, and the tibia reason is tibia and fibula. So it is an amputation. Tibia and fibula is an amputation reason because it isn't from the bone. The removal of the limb from the lower limb from the bone area, okay, not the joint area. So we'll just navigate this ICD and CPT code for the this procedure, this OP. So what is diagnosis? That is a diabetic foot with gangrene. So gangrene will with diabetic, other specified, unspecified, no. Diabetes mellitus do not wish to code more, and diabetic peripheral angio do not wish to already. So here is an ICD for the this one, and we should not give gangrene here because it is included in the, oh, I have deleted that. Okay, no. Gangrene with diabetes, other, unspecified, no. So E1152. Okay, we'll just remove the gangrene code only because it is a diabetes type 2 diabetes mellitus with the gangrene is included here. That's why I will not give. And what is an procedure? Procedure is an right below knee amputation. So here is an properly match the what were the procedure given, and in the description also match that. Okay, so we'll give the amputation CPT code. So amputation, amputation by site. Hmm. So it's a knee. Not oh, okay. It's in disarticulation. Sorry, guys. It's an upper limb, lower limb was there. Okay, lower limb. So below the knee amputation. So amputation above knee, below knee. And there is an unspecified. So there is an immediate fitting. So then primary closure achieved. So we'll give the 27880 CPT code. Okay, 27880 with the RT modifier. Oh, sorry, guys. RT modifier. Okay, RT modifier will give that. So here is a navigation for the amputation topic. Next we'll see the another one topic, that is an, I say that now you should have to learn that the guillotine amputation, and we'll see the reason whether it is an arm or some another reason. So preoperative diagnosis for the day 1, that is an guillotine amputation, and the preoperative diagnosis diabetic foot with a severe infection and gangrene lower left limb. It means below the knee. It's a knee region. Okay, knee joint, and procedure is below knee guillotine amputation. Okay, and the operative note, due to the extensive infection, guillotine amputation was performed below the knee and the limb was amputated through the tibia and fibula, infected tissue removed and wound left open for drainage and sterile applied. And for the day 3, secondary closure. Okay, secondary closure. So procedure performed, that is in secondary closure of the left below knee amputation stump, and operative note is patient brought back to OT and the stump was inspected and debrided wound was age approximated and proper stump formation and closure were performed in layers. So it is then 2 procedures performed. First for the guillotine amputation. So it is an amputated knee, that is through the tibia and fibula, infected tissue removed and the wound left open. And the procedure performed was secondary closure. We'll give for that a stump, proper stump formation is there. So first we'll give the ICD. ICD is just diabetic foot with severe infection and gangrene, which will be same just like this code is E1152. So we'll navigate for the procedure. Okay, 27. So what is procedure? Amputation of the knee. Amputation of the lower limb, below the knee amputation, primary closure, and for the secondary closure we'll give the 1 series code. Okay, 10,000 series code. So what were the closure of the continue the list. Wound dehiscence. Okay, wound dehiscence. Closure of the other one, complicated extensive secondary closure will be there, so I'll give that. So this one, so we'll give that. Just remove these all. So this is the amputation and the secondary closure procedure. Okay, and ICD is E1152 for that. So I'll give the modifier LT, and it is an again one modifier will give for that, that is an stage related 58 modifier. Okay, and here for the right, it's on left side, so modifier will be removed and we will select left side. Okay, so this one is a procedure for the amputation topic, that is on day 1, day 2. Okay, now so disarticulation, we already see that. What is disarticulation? Removal of the limb through the joint, and the amputation is an removal of the limb through the bone. Okay, next we'll see the another procedure, OP report for the amputation topic. Okay, so what is preoperative diagnosis? PVD with the gangrene and post-operative same, and the procedure performed is an right knee disarticulation, and anesthesia is general, and indication is patient preserved with the severe ischemia and the gangrene with the right lower limb, and limb was non-salvable, planned for disarticulation. So it is a disarticulation topic. An operative note is an patient was taken to OT and placed in supine, and after sterile preparation, an incision was made around the knee. So it's an open procedure, and the soft tissue were dissected, and the limb was disarticulated at the knee joint. So disarticulation means removal of the limb from the joint. Okay, and the no bone cutting was performed, and hemostasis achieved, and skin flap were created. Okay, and the stump was saved and closed in layer, and sterile dressing applied. So we'll navigate that. Okay, so PVD with the gangrene. PVD, that is an peripheral vascular disease. It's an arteriosclerosis of the extremity because it's an that is an blockage of the arteries and vein. So it's an diabetic, unspecified. No, this one is not an code for this. Others, sorry, other specified. It's an leg, na, for the leg. Which leg? It's an right leg, and gangrene is there with the gangrene. Other specified, not Westergaard mode. So this one is the code for the arteriosclerosis of native arteries, that is in PVD with gangrene. Okay, I-70 261. Now next one, right knee disarticulation. So here is an incision done. It means an open procedure of the and the knee disarticulation because the dissected and disarticulated at the knee joint. No cutting performed. There is a no amputation. Here is a disarticulation. So we'll navigate the by word disarticulation. Disarticulation of the knee. So here is a disarticulation of knee. Which right side? So that's it. So guys, this is an today's topic we have covered. Okay, and that is on manipulation and amputation. So, and the next topic we'll cover the bunion, hammer toe, and these rest of the topics in the next session. Okay, so that's it, guys, for today. So please like and subscribe my channel.